Hi everybody, and welcome back to my channel. My name is Linda Salter, and I am a massage therapist with 20 years experience and the inventor creator of Butt-thotics orthopedic wedge that levels your hips in seated position, helping get rid of your back pain, neck pain, and headaches. Today I'm just going to do a short video about B12 deficiency. Now, if you look it up, a lot of people have this, mainly seniors, later on in life. If you look it up on Dr. Google, it's going to tell you pernicious anemia causes, or poor diet, you need to eat more of these foods. But a lot of people do that and it still doesn't help. Or you take vitamins and it still doesn't help. Some people have to go get injected B12 because taking vitamins isn't enough, oral vitamins. Have you ever heard, though, that vagus nerve can be the cause, damage to vagus nerve can be the cause of your B12 deficiency? That's right. And where is vagus nerve? Vagus nerve comes out of both sides of your brain, of your head, right behind your ear in front of C1. In front of C1, where there's a lot of movement and you can damage it quite easily. So it'll say if you have gut problems, you probably aren't able to absorb the B12, or what if the nerve that feeds your guts is being damaged up here, causing your gut problem and the problem of your absorption of B12. So how does vagus nerve control the absorption of B12? It signals the parietal cells in the stomach to make intrinsic factor. Intrinsic factor is needed to absorb B12. So if little damage, especially on the right, this is my right, right side vagus nerve tends to control most of your guts. Yes, your guts have a brain of their own, but guess who controls that? This guy. So if you're having some neck issues, or you're having gut problems, or you're having certain urinary issues, you feel depressed even, that could be vagus nerve damage, and you're B12 deficient. So if you fix your neck and stop the damage happening up here, which is very common today with looking down at our phones and our computers, you can fix your problem. You can also fix your gut problem. But today we're just talking about B12. So have you ever heard about that? So damage to because they used to do, look it up. I want you to look it up on Wikipedia under clinical significance. They used to cut the vagus nerve to treat peptic ulcers years ago. And they found that when they did that, I don't know where they cut it. If they cut it here somewhere closer to the stomach, so after cutting, it would help with peptic ulcers, but they found that people became B12 deficient, and that can be dangerous, right? So it doesn't, like taking B12 supplements might help, but if it's not helping, it's because you can't absorb it. Fix your vagus nerve, fix the absorption of B12. And another thing about B12, vitamins or supplements, there's two types that, there might be more, but I'm talking about two types. There's cyanocobalamin and methycobalamin. And I've done research on these things, and you might want to try it too, because the cyanocobalamin has a molecule, is like a molecule of cyanide, okay? So it's a synthetic form of B12, and it's the cheapest form. So everywhere you go, and all your fortified by B12 everywhere, you're getting the cyanocobalamin version of B12. In my opinion, you best be looking at the methycobalamin. Look it up, decide for yourselves, Again, go on Wikipedia and look up vagus nerve and go under clinical significance. Read the whole thing if you want. They've also done studies, another interesting fact. They've done studies in Norway, Australia, and I can't remember where else. They did studies where they blocked the vagus nerve during the day, and people lost 15% of their body weight just by doing that. They've done studies over 15 years ago. Ever heard about that? No, you haven't. I wonder why. Anyways, just some interesting facts today. How your neck can be the cause of your health problems. Okay, so thanks a lot, and we'll talk to you soon.